Top 25 Caretaker Interview Questions and Answers. In today's video, we're diving into one of the most requested topics, the top 25 caretaker interview questions and answers. Whether you're applying to care for children, elderly individuals, or clients with special needs, these questions will help you shine in your next interview. I've crafted clear, professional, and confidence-boosting answers to help you stand out from the competition. So grab a notebook, take some notes, and let's get you fully prepared. Let's jump straight into it. 1. Tell us about yourself. I am a compassionate and responsible caretaker with experience supporting individuals of different ages, including children, seniors, and people with special needs. I take pride in being patient, dependable, and attentive to the emotional and physical needs of those I support. Over the years, I've developed strong communication and problem-solving skills, allowing me to maintain a positive environment while handling daily routines, safety concerns, and unexpected situations. I am passionate about helping others live comfortably and independently, and I take my role seriously. I'm now looking for a position where I can contribute my skills in a meaningful and long-term way. 2. Why do you want to work as a caretaker? I want to work as a caretaker because helping others brings me purpose and fulfillment. I've always been naturally patient, caring, and attentive, and this role allows me to use those qualities in a meaningful way. I enjoy creating a safe and supportive environment for people who may need assistance with daily tasks or emotional support. Being a caretaker allows me to make a real difference in someone's life, and that sense of impact motivates me. I'm committed to continuing my growth in this field and providing the best care possible to every individual I work with. 3. What experience do you have in caretaking? I have hands-on experience caring for individuals across different age groups and needs. My responsibilities have included assisting with daily tasks, preparing meals, administering medications under supervision, maintaining hygiene routines, mobility support, companionship, and monitoring health changes. I've also worked with individuals with dementia, physical disabilities, and chronic illnesses. This experience has taught me how to remain calm, organized, and adaptable in various situations. I have also gained strong communication skills by working closely with families, nurses, and therapists. Each role has strengthened my ability to provide compassionate, safe, and personalized care. 4. How do you handle difficult or aggressive behavior? When dealing with difficult or aggressive behavior, I remain calm, patient, and professional. I focus on understanding the root cause, whether it's frustration, confusion, discomfort, or a medical issue. I avoid reacting emotionally and instead use de-escalation techniques like speaking softly, giving space, and offering reassurance. I prioritize safety and assess whether the individual needs medical attention or a change in routine. Communication and empathy are essential, so I listen carefully and try to provide comfort. If needed, I report the behavior to the family or supervisor and document it to ensure consistent support and proper follow-up.
5. How do you ensure the safety of the person you're caring for? I take safety extremely seriously and always begin by assessing the environment for potential risks, such as loose rugs, slippery floors, or sharp objects. I follow all safety guidelines set by the family or medical professionals. I monitor the individual closely during activities like mobility assistance, bathing, and medication routines. I encourage safe habits and maintain a calm, structured routine to reduce accidents. I also stay alert for any signs of medical issues or behavioral changes. In emergencies, I respond immediately and follow established protocols. My goal is always to provide a safe, comfortable, and supportive environment. 6. How do you handle stress on the job? Caretaking can be emotionally and physically demanding, but I manage stress through organization, communication, and self-awareness. I stay calm under pressure by focusing on solutions rather than problems. When tasks become overwhelming, I prioritize what needs immediate attention and handle responsibilities step by step. I also pay attention to warning signs of burnout and practice self-care outside work, such as rest, exercise, and healthy routines. Asking for support or clarification when needed is also important. By staying balanced and maintaining a positive mindset, I can provide consistent, high-quality care even in challenging situations. 7. How would you respond in a medical emergency? In a medical emergency, I remain calm and follow the established emergency plan. First, I assess the situation quickly, checking breathing, consciousness, and safety risks. If necessary, I call emergency services immediately and provide clear information. While waiting for help, I offer first aid within my training level and ensure the individual is as comfortable and safe as possible. I also notify the family or supervisor right away. After the situation is under control, I document the incident and review what happened to help prevent future emergencies. Acting quickly, responsibly, and calmly is always my priority.
8. What are your strengths as a caretaker? My strengths include patience, empathy, strong communication, and attention to detail. I am reliable, punctual, and able to stay calm in stressful situations. I have the ability to connect with individuals emotionally, making them feel comfortable and supported. I'm also highly organized and attentive to routines, medications, and safety procedures. Another strength is adaptability. I can adjust quickly to changing needs or conditions. Overall, I take my responsibilities seriously and always strive to provide compassionate, respectful, and personalized care. My goal is to improve the well-being and quality of life of the person I am caring for. 9. What are your weaknesses? One of my weaknesses is that I sometimes try to take on too many responsibilities because I want everything to run smoothly. However, I've learned the importance of pacing myself and asking for help when needed to prevent burnout. Another weakness is that I can be overly cautious, especially when assisting with new routines or medical needs, but I've found that caution can also be a strength in caretaking. I'm constantly working on improving my confidence in new situations and staying balanced. Overall, I see weaknesses as opportunities to learn and grow. 10. How do you build trust with the person you're caring for? Building trust takes time, patience, and consistency. I start by listening carefully and showing genuine interest in their comfort and needs. I speak respectfully, maintain confidentiality, and always follow through on my promises. I respect personal boundaries and allow the person to express preferences, helping them feel in control. Consistency is key, so I show up on time, stay calm, and provide steady support. I also maintain a positive, friendly attitude while respecting their emotional and physical needs. Over time, these behaviors help create a strong foundation of trust and comfort. 11. How do you stay organized during a busy day? I stay organized by using checklists, schedules, and clear routines to manage daily tasks efficiently. At the start of each day, I review priorities such as medication schedules, appointments, meals, and personal care needs. I break tasks into manageable steps and adjust the plan if unexpected situations arise. Communication is key, so I stay in touch with family members or health professionals. I also keep the environment tidy, which helps maintain order and safety. My organized approach allows me to provide consistent, reliable care while staying flexible when unexpected needs arise. 12. How would you handle a situation where the patient refuses help? If a patient refuses help, I remain calm and respectful. I try to understand the reason behind their refusal, whether it's discomfort, fear, embarrassment, or simply wanting independence. I offer reassurance and explain why the assistance is important, using gentle and encouraging communication. If possible, I give them choices to maintain their sense of control. I avoid forcing help unless safety is at immediate risk. If refusal becomes frequent, I report it to the family or supervisor and document the behavior. Building trust and patience usually helps the person accept help more willingly over time. 13. Describe your experience with medication management. I have experience assisting with medication reminders, maintaining schedules, and ensuring medications are taken safely and correctly. I do not administer medications unless allowed by the family or healthcare professional, but I can help with organization, such as preparing pill boxes, recording doses, and monitoring reactions. I always double-check instructions and communicate with the family about any concerns or changes. I understand the importance of accuracy and responsibility when it comes to medication. If I notice side effects or missed doses, I notify the family or nurse immediately to ensure proper follow-up. 14. How do you ensure proper hygiene for the person you're caring for? Proper hygiene is essential for health and comfort, so I approach it with sensitivity and respect. I maintain routines that include bathing, grooming, oral care, and clean clothing. I always explain each step beforehand, especially if the person feels uncomfortable. I help them maintain independence where possible while providing support with safety and dignity. I ensure the environment remains clean and sanitary, including changing bedding, cleaning surfaces, and managing laundry. I also monitor for signs of skin irritation or infections and report anything unusual. My approach prioritizes cleanliness, comfort, and respect. 15. What would you do if the patient fell? If the patient falls, my first priority is safety. I remain calm and check for injuries without moving them unless they are in immediate danger. I ask how they feel and look for signs of pain, bleeding, or broken bones. If necessary, I call emergency services right away. If they can get up safely, I assist them slowly and carefully. I report the fall to the family or supervisor and document what happened, including the time, location, and possible cause. Afterward, I assess the environment to prevent future falls and make necessary adjustments. 16. How do you manage time when caring for someone with many needs? Managing time effectively starts with understanding daily priorities and creating a structured routine. I break tasks into smaller steps and schedule them based on urgency, such as medications, meals, and hygiene needs. I stay flexible because unexpected situations may arise, but having a plan helps maintain order. Communication with the client and family is essential, as it ensures everyone understands the schedule and expectations. I remain calm under pressure and focus on completing tasks efficiently without compromising the quality of care. Organization, patience, and adaptability help me manage busy caregiving days smoothly. 17. How would you care for someone with dementia? Caring for someone with dementia requires patience, empathy, and consistency. I create a safe environment by reducing hazards and following familiar routines to reduce confusion. I communicate clearly using simple language and maintain eye contact. I listen attentively and offer reassurance when they feel anxious or frustrated. I regulate stimuli around them, avoid arguing, and redirect their attention when necessary. I monitor changes in behavior and report anything unusual to the family or medical professionals. My goal is to provide stability, emotional comfort, and respectful support while helping them maintain dignity and independence as much as possible. 18. What motivates you as a caretaker? What motivates me most is the opportunity to make a positive impact in someone's daily life. Being a caretaker is more than completing tasks. It's about offering companionship, emotional support, and comfort to someone who truly needs it. Whether it's helping them feel safe, encouraging their independence, or simply brightening their day, I find fulfillment in knowing my work matters. Building meaningful relationships and improving someone's quality of life keeps me motivated. Every day brings a chance to help someone feel valued and cared for, and that purpose inspires me to give my best. 19. How do you handle confidential information? Confidentiality is essential in caretaking, so I handle all personal information with professionalism and respect. I never share private details about the individual, their health, or their family unless authorized or required for safety reasons. I follow all rules regarding privacy, whether written or verbal, and ensure documents or notes are stored securely. I'm careful when discussing sensitive information, making sure conversations happen in private settings. Maintaining trust is crucial, and respecting confidentiality strengthens the relationship between the caretaker, the client, and their family. 20. How do you communicate with family members? I believe clear, respectful, and consistent communication with family members is essential. I provide updates on the individual's daily routines, health changes, behavior, and any concerns that arise. I listen carefully to the family's expectations and preferences to ensure the care aligns with their goals. I communicate honestly and professionally, whether delivering positive updates or addressing challenges. I also ask questions when needed to clarify instructions or understand changes in care routines. Maintaining open communication helps build trust and ensures the individual receives the best support possible. 21. Describe a time you handled a challenging situation. In my previous role, I cared for an elderly woman with dementia who often became anxious during bathing time. One day, she became scared and refused to enter the bathroom. Instead of pushing her, I calmly reassured her and explained each step. I gave her time, redirected her attention by talking about her favorite music, and played it softly. This helped relax her, and she eventually agreed to proceed. I documented the incident and discussed it with the family to adjust the routine. This experience reinforced the importance of patience, empathy, and flexibility. 22. How do you handle disagreements with a family member? If I disagree with a family member, I approach the situation with respect and professionalism. I listen carefully to understand their concerns and avoid reacting emotionally. I explain my viewpoint calmly, focusing on what's best for the individual receiving care. My goal is to find a solution rather than argue. If necessary, I ask clarifying questions or refer to the care plan to ensure consistency. If the disagreement continues, I involve a supervisor or healthcare professional for guidance. Maintaining positive relationships is essential, so I always aim for respectful and constructive communication. 23. What is your approach to companionship and emotional support? I provide companionship by being attentive, listening actively, and engaging the individual in meaningful conversations or activities they enjoy. Whether it's taking walks, playing games, reading aloud, or simply talking, I make sure they feel valued and understood. Emotional support is equally important, so I respond to their feelings with empathy and patience. I create a warm and comfortable environment where they feel safe expressing themselves. By being present and supportive, I help reduce loneliness, anxiety, and stress, ensuring they feel connected and cared for. 24. How do you maintain boundaries while caring for someone? Maintaining boundaries is important for professionalism and respect. I create clear separation between my caregiving responsibilities and personal life while still building a warm and trusting relationship. I avoid discussing personal issues or overstepping the family's rules. I also respect the individual's privacy, space, and preferences. While being friendly and supportive, I remain consistent with the care plan and focus on the person's needs. Setting healthy boundaries ensures comfort for both parties and allows me to provide high-quality care without misunderstandings. 25. Why should we hire you? You should hire me because I am dedicated, compassionate, and experienced in providing high-quality care. I treat every individual with respect, patience, and dignity. My strong communication skills, reliability, and ability to remain calm in difficult situations allow me to deliver consistent and safe care. I adapt quickly to new environments and follow care plans closely while also understanding the emotional needs of those I support. I am committed to building trust with the family and the person receiving care. Above all, I genuinely care about improving the quality of life for those I work with. Thank you for watching. I hope these top 25 caretaker interview questions and answers help you feel confident and well prepared for your upcoming interview. If you found this video helpful, make sure to like, share, and subscribe for more job-winning interview guides. And don't forget to check out our playlist for other interview topics that can boost your career. Best of luck. You've got this, and your next caretaker job is just around the corner.